Many patients are understandably anxious about undergoing their first eye injection. Thankfully, these days, it's a very well tolerated procedure and generally painless. An intravitreal injection is an injection of a medication into the gel of your eye, which is called the vitreous. A number of different medications can be injected, but the common names are Eylea, Lucentis or Avastin. A number of eye conditions are treated with intravitreal injections, and the common ones include macular degeneration, retinal vein occlusions, and diabetic retinopathy. These medications all work by the same mechanism of action, and that is to stop new blood vessels which are growing at the back of the eye from leaking fluid. It's this fluid which can cause scarring in the retina and eventually affect the patient's central vision. Thankfully, over the past 2 decades, these medications have been very effective at reducing central vision loss from these conditions. On the day of your procedure, you can expect to have your eyes dilated by one of our orthoptists, which is one of the normal parts of your eye examination. Then some local anaesthetic drops will be placed in the eye, and the doctor will perform a subconjunctival injection of local anaesthetic, which is a small amount of anaesthetic which is injected under the upper lid so that you don't feel any pain during the injection itself. A wire speculum can be used to hold the upper lid out of the way, and we always clean the eye with antiseptic solutions such as chlorhexidine or betadine to reduce the risk of infection. The needle that's used is a very small gauge needle similar to an insulin syringe, and the medication is injected in the white part of the eye where it borders the coloured part of your eye. After this, the eye is washed out to remove any remaining antiseptic. Patients don't require a pad generally, and they can usually go back to fairly normal activities that day. It's not unusual to feel some grittiness in the eye on the day of your injection, and some patients will notice some floaters that occur for a few days after the injection. As with any medical procedure, there are some risks associated with intravitreal injections, but thankfully these are quite rare. The risk of having high pressure in the eye, inflammation in the eye, or damage to the lens or retina of the eye as a result of injection is rare, estimated at about 1 in 500. The most serious risk we worry about is that of infection in the eye as a result of an injection, such as endophthalmitis. Endophthalmitis, though, thankfully is exceedingly rare, estimated at about 1 in 2,000. It's very important, however, that if you notice any unusual symptoms in the days after your injection, that you contact your doctor here at Northern Beaches Cataract. Those sort of symptoms might be increasing pain, sensitivity to light, or blurred vision that go on beyond the first day after your injection, particularly within the first 10 days following an injection. Please do contact your doctor if you're having any symptoms after your injection, and they would see you promptly. If you have any questions about your procedure or wish to discuss the ins and outs of the injection process, please contact the staff at Northern Beaches Cataract or speak to your doctor during the appointment.